Welcome back to Western New York Living. Doing things virtually has become a common way of life for many people. Even visiting doctors has become virtual, and it's oftentimes beneficial for both the patient and the doctor. Now, Dr. Jill Bernstein from the Hearing Evaluation Services of Buffalo would agree with this statement and joins us now. Nice to meet you.
Hi, thank you. You too.
Dr. Bernstein, at Hearing Evaluation Services of Buffalo, you're now offering a virtual office for patients. Can you tell us how that works and why it's beneficial for your patients?
Yeah, we've kind of joined the rest of the world when COVID hit to trying to make things more convenient and easy for people. And all you need is a smartphone or a tablet or a computer. And we can have an interaction like this where I can talk to you about your hearing needs, help you troubleshoot if you have hearing aids, if you're having some issues. And if you have hearing aids, we can also remotely connect to them so that if you need a program adjustment or something like that, we can do it. So it's great for people who have transportation issues or working people who don't want to take half a day off to leave to go to an appointment when it's something that we can just do in a quick 5 minutes. So we found that people have responded really well to it, especially as people are preparing to flee this area for the winter and go to warmer territory.
Well, it certainly makes the visit convenient. What type of services do you offer through your virtual offices?
We can actually screen your hearing if you use some earphones during the appointment. We can talk about hearing aids if you're new to the process. We can help you troubleshoot if you're having any issues with hearing aids that you currently have, and then program the hearing aids as well and make any adjustments.
Now, I know that the virtual office is ideal for people who do not want to come into the office, but it's also great for those who may leave the area, like you said, for the winter or travel a lot. Is that right?
Yeah, it's great. I've used it really conveniently with a couple of my patients who had really simple needs that took us literally 2 minutes to do via a virtual office appointment instead of them having to drive, 20 minutes to the office and then have an appointment and then drive home again. So it was a lot more convenient for all of us.
Now, for anybody that has questions on hearing aids, you have a great event coming up this Tuesday. Can you tell me about this hearing aid seminar?
Yeah, so kind of another pivot we've made during COVID is to offer some online seminars on important topics. And we're entering the open enrollment period for insurance plans. And a lot of the insurance plans, particularly the Medicare Advantage plans for older people, do have some kind of hearing aid benefit associated with it, but it's not always easy to understand. So our insurance specialist is going to be hosting a seminar to help people understand the insurance benefits related to hearing aids that are going to be coming out this year for their plans. And that's going to be this Tuesday at noon, the 16th.
Now, with November being Alzheimer's Awareness Month, it's also important for people to know about the link between hearing loss and dementia. Can you tell us a little bit more about this?
Yeah, so this is really big. Alzheimer's is a type of dementia, and a lot of studies in the last 8 to 10 years have actually shown a relationship between untreated hearing loss and memory impairment and changes in cognition. And even a mild untreated hearing loss that people think is just not a big deal because they get along without any issues actually doubles the risk of dementia in the long term. And the more hearing loss you have, the more it increases your risk. There's other health consequences as well that you wouldn't expect: increased risk of falls, hospitalization, depression. The great thing that we know is this is a really modifiable risk factor. All we have to do is treat the underlying hearing loss, and we can really mitigate all of those issues. So getting hearing aids that are properly fit for your hearing loss by an audiologist is really the best way to go to make sure these things don't happen.
Dr. Bernstein, thank you for your time today. Some great information. Now, Hearing Evaluation Services of Buffalo has 5 office locations across the area. To find out more about all the hearing services they provide, head over to their website at hesofbuffalo.org, and you'll also find a tab on how to make an appointment for their virtual care office. Remember, everyone is invited to take part in their hearing aid seminar that's happening this Tuesday, and you can register at hesofbuffalo.org/seminar. Now, coming in our second half hour, Big Brothers Big Sisters will be joining us to talk about some wonderful ways you can help make a difference in a child's life. We're just getting started out on today's Western New York Living.
This segment of Western New York Living was sponsored by the following: